Good afternoon. I'm Dr. Al Natelli, and a moment ago I spoke to you about fillings and cavities. If the cavity gets too deep and into the nerve of the tooth may require a root canal. What is a root canal? A root canal is removing the tissue inside the tooth and sealing the tooth off so that bacteria cannot get down the root and into the bone. How do we do a root canal? The first thing we do is get you numb with local anesthesia. After we get you numb, we remove the decay that's inside the tooth and or the filling and expose the nerve of the tooth. Once we've done that, we use instruments to go down the canals of the tooth and clean this out. Once clean, we'll irrigate it several times along the way, dry those canals, and then use a material called gutta percha to seal these off. I like to joke with my patients and say it's Carmack. Remember the hermetically sealed envelope from Johnny Carson? We seal your tooth off so that bacteria cannot get into the tooth this way or into the bone down here. Once a root canal is completed, we like to restore the tooth with some kind of buildup, whether it's a post and core or a core, and a crown. Each tooth is different, and so you and your dentist will discuss that accordingly. I have an example of a root canal here. This is the start, and we can see the cavity here. And if you can't see it, allow me to enhance the x-ray. When the x-ray is enhanced, we can see the black spot here underneath the filling. When we clean this out, we expose the nerve of the tooth. Once exposed, we use files to go into the tooth and clean and shape this out. Once cleaned and shaped, we seal the tooth off and we set the tooth up to be restored with a crown. Root canals have a bad reputation for being painful. When done correctly, when done well, and when done right, they're not painful at all.